Let's talk about breast symptoms. So, a breast symptom is a kind of a catch-all or grab bag term that's used for a number of different things that a person can experience that could potentially lead to a diagnosis of either an infection, a benign finding, or potentially a cancer. So, the question that we always get at the breast center is, when should a symptom be evaluated? And the generic answer to that is, you should never ignore a symptom. However, there are certain symptoms that are less serious than other more concerning symptoms. And some of the less serious symptoms, some of the less concerning symptoms are, globalized breast pain, pain that kind of, moves throughout your breast and maybe radiates somewhere and maybe waxes and wanes, gets worse one day, gets better another, related pain related to, moving your arm or something like that. Um, that's, less of a concerning symptom. Bilateral milky discharge, greenish discharge, especially, around a certain time of your cycle, or related to childbearing, whether you're pregnant or you just had an offspring. Um, Milky discharge, especially bilateral, is usually a benign symptom. Transient redness that, you may have seen redness on your breast and it went away after 2 days. That could be related to, mild mastitis or potentially a bruise or something like that. Um, but if you're concerned, if you're confused, come get it evaluated. It's better for us to tell you that it's nothing than for you to talk yourself out of something, reassure yourself, and it be something bad down the road. Um, More uh, concerning or more serious symptoms, symptoms that absolutely need to be evaluated. The big one is a palpable lump. It's probably the most common symptom that we encounter. It's important to have an idea of what your breasts feel like at baseline. And usually I tell patients, have an idea at the same time of each month of what your breasts feel like. And if you notice a change during that time each month, especially if it's a lump that you don't think was there before, and if the lump gets bigger over the course of, a couple of months, a couple of weeks into a couple of months, come get it checked out. There's a lot of things that can cause breast lumps. Doesn't necessarily mean that it's cancer, but it needs to be evaluated. Focal breast pain, pain that you can take your finger and stick on your breast and say it hurts right here, especially pain that starts to kind of grow slowly, that needs evaluated. Skin changes, such as skin dimpling, if you notice a new dimple on your skin, or if you notice that there's a new area of redness or what we call erythema that's not going away, that's starting to get tender and or hard, that needs evaluated. Nipple changes, such as nipple inversion. If your nipple was out and now it's in and it's never been inverted before, especially if you can't evert it, even if you can evert it, new nipple inversion always needs to be evaluated. Um, Talked about benign discharge, such as milky or greenish discharge, bloody nipple discharge, clear nipple discharge, always needs to be evaluated. So if you're experiencing these types of symptoms, or really any type of symptom that's concerning to you or is confusing, or, it's something that, you're got a heightened sense of awareness about, come get it checked out. That's what we're here for at the breast center. You're not wasting our time. We're here to evaluate you and get you the appropriate diagnostic workup that you need.